have neuroimmune disease, sometimes called myalgic encephalomyelitis, chronic fatigue syndrome, fibromyalgia, Lyme disease or chronic Lyme, Gulf War illness, and autism. Those are the illnesses covered under the spectrum of neuroimmune disease. In my case, one of my major issues seems to be reactivated tick-borne illness. I've been sick for 5 years. I've been sick my whole life, really. I have Ehlers-Danlos and mast cell activation disorder and some poorly characterized immune dysfunction. But I got really sick 5 years ago after a trip to Japan. I picked up a virus and it started my descent into neuroimmune disease, and I have not yet recovered. But in the last year, I've been visiting Open Medicine Institute. My doctor is David Kaufman. He's very good. And after a lot of infectious testing and trials with antivirals, which didn't work at all, I found some good treatments. I'm doing IV antibiotics, Rocephin. I'm also taking rifampin right now, which has been a little more difficult. The Rocephin's been very easy for me to tolerate, even though I'm extremely sensitive to drugs. Naltrexone has helped with my pain, low-dose naltrexone, Celebrex, and I do fecal matter transplant to try to save my gut after, it's going to be 6 to 9 months of a combination of antibiotics, and then I might need another 6 to 9 months of different antibiotics for Babesia, which I've tested antibody positive for. Anyway, I thought today I would try to demonstrate how I push my IV Rocephin in case anybody else has to go through this and would like some instructions. So first, I have washed my hands, and glove management is important. Although gloves are not entirely sterile, they come out of a box and they're exposed to air. But it's a good idea to put gloves on. At least I think it's a good idea. In the hospital, if you have a dressing change once a week, you have to really watch nurses and their gloves, because nurses typically use gloves to protect themselves and not you. So a lot of nurses I see put their gloves on, they go touch a bunch of things, and they come in and start taking off my dressing, and I have to tell them, please change your gloves, put new gloves on right before you go in there. Even that, you really have to be careful around when the dressing is open more than anything. You've got to be very careful around the area. Wear a mask, don't breathe on the area when your dressing's being changed. And when you're doing your PICC line changes, I don't wear a mask, you could, but just be conscientious of this end, which now is capped. But when you open it up, that's the thing you want to make sure doesn't get too exposed to air. So I have removed the lock, which is the heparin lock, and I'm sort of massaging the kink out of my line. And now I'm going to put my gloves back on, which is not easy once you've taken them off. And the setup that hopefully you can see here is saline, Rocephin antibiotic, saline, and heparin. Sometimes they call it SASH as an acronym, sort of, for the order you want to do things. So you want to first get yourself an alcohol wipe. Be careful not to touch things, especially now I've uncapped this. Try not to breathe on it. And for 30 seconds, apply pressure with the alcohol wipe. So you can count 1, 2, 3, 4, 5, 6. But you want to do this for a full 30 seconds and apply pressure, not just kind of wipe at it gently, but really get in there. I also have a timer that I use, and I don't use it to time the alcohol wiping, but I do use it to time my antibiotic injection, because it's supposed to be given over 5 minutes. You don't want to push too quickly, for sure. Also, in between, when the cap is off my PICC line, I leave the alcohol on it so it's not just hanging out in the air. This is saline. So you pull back on the plunger and then push until you get a little saline. Screw it into your PICC line. I use the alcohol wipe actually to disinfect my gloves sometimes. And then push quickly. And there's the saline. I leave this dangling. You have to be careful about the top of your PICC line. You don't want it to kink, but at the same time, I don't really want to just take it off and leave it exposed to the air again. So now I'm on my second alcohol wipe. "30 seconds, apply pressure." I'm going to do some more videos. Another treatment that is completely disgusting, and if anyone told me 5 years ago I would be doing it, is I would have said you're crazy, is bacteriotherapy. I'm very lucky I have a donor. I also live in Sacramento, where we have a place called Advancing Bio. It's a fecal donor bank. So if you have a potential donor and you live in Sacramento, you can have them screened basically for free if they donate stool, which is in, pretty heavy demand, not as much as blood, but people with C. diff can legally have fecal matter transplant done. Myself, I'm a DIY person. If you go to powerofpoop.com, you can learn more about it, but that's another therapy that's really helped me during my antibiotic course. I'm almost at month 3 of Rocephin, and I've only been on rifampin for a few weeks. So this is the antibiotic. And I time for 5 minutes. There's 2 grams of antibiotic, and so it's basically 1 cc every 15 seconds. So this is going to be boring for 5 minutes, but I have a lot of pain. Anyone else with neuroimmune disease, especially people with tick-borne illness, seem to really suffer from pain. That's probably my worst symptom. I mean, I was in bed for years, basically. I'm out of bed now and out of a wheelchair for the most part because of the IV Rocephin. Before that, it was just sort of stabbing around in the dark. I spent 2 years at the UC Davis Medical Center going from doctor to doctor, specialist to specialist. Nobody could help me at all. Then I got to Stanford, and they're very big on antivirals, but they really didn't do completely, they're not Lyme literate, I'll put it that way. At least they didn't seem to be. They just were relying on standard ELISA tests for Lyme. It wasn't until I got to Epimedicine Institute and did extensive testing with IGeneX and Galaxy twice. I went through the same testing twice. It was expensive, but worth it. The same 4, I guess, antibodies kept showing up: Lyme, Babesia, Bartonella, relapsing fever. And my doctor certainly felt convinced enough that I needed antibiotics to start me on some, and thank God he did, because I was, for the last 2.5 years, I spent 18 months of it in bed, wanting to die, praying to die, hoping to die, thinking about death. It was very miserable. So although I'm far from being well, I'm a lot better than I was. I'm also, I did the Celtran tests. So I have autoantibodies to beta-adrenergic and muscarinic receptors in my body. There's autoimmunity to those receptors. Those receptors control a lot of processes, especially blood flow, vasoconstriction. That was one of my earliest symptoms, actually, was the sort of hyperreactive vascular stuff going on. Certainly I've always been prone to migraines, but I could watch the veins on my arms constrict or dilate. I was getting migraines all the time too. Inflammation in the body, the blood vessels, your autonomic nervous system clearly doesn't work properly, but some of it could certainly be due to this autoimmunity to muscarinic and beta-adrenergic receptors. But anyway, back to the Celtran test. Mine were pretty much positive across the board. So my doctor thinks Rituxan, I might be a good candidate for Rituxan. It's hard to know until the phase 3 Norwegian trials are finished. Fluga and Mella in Norway, quite some time ago, discovered that they were using Rituxan, I think, for people with lymphoma, and one of them was a longtime ME patient, and their ME got better. So they've been trying to find out why what it is. There's maybe 60% of us who do have autoimmunity. And certainly the longer you have the illness, the more autoimmune it seems to become. So Rituxan, if the antibiotics clear up the infection and the autoimmunity goes away, great, but that doesn't always happen. So Rituxan certainly might help with the autoimmunity. And then the third thing is this whole dour hypometabolic state. So if I get rid of the infections and I get rid of the autoimmunity, will the dour process turn back on? Maybe. It seems to, certainly in some patients. So I'm crossing my fingers. Rituxan is very expensive in the United States. It's $60,000 for a full course of Rituxan here. There's a clinic in Norway where it costs a lot less, $18,000 for a full course of treatments. There might be more than one clinic. I know of one. I can't remember the name. I want to say it's like Colibri. But that is probably where I'm going to be going if I pursue Rituxan, which I think I will. If this doesn't completely cure me, which I'm guessing it's not, but you never know. I'm only on antibiotic number 2. There might be a third one mixed in. Okay, I'm almost done with this. So you can see there's a little air bubble in the end, and I don't push all the way, although a small air bubble is apparently not going to hurt you. You don't really want a bunch of air in your PICC line, so I'm going to leave that hanging. Again, wipe with the alcohol wipe, 30 seconds. Sorry, I'm just checking the time. Yeah, again, I've been sick, really on and off my whole life. I had a sort of a PANS-like onset of neuropsych symptoms when I was 13. Yet these things would wax and wane for me. There would be periods where I was completely healthy. I was actually really active. I used to be a gymnast as a child, and even as an adult, even after I got sick with ME and I didn't know what was wrong with me for the first 2 years, I still exercised heavily, like 10-mile hikes and an hour or an hour and a half at the gym every single day. So it's really hard if you're an active person to go from really active to bedbound, which happened to me in 2014. I was sick and I didn't know what was wrong. I knew something was wrong, and my doctor had shuffled me off to psychiatry and psychology for a few years. Much to my disgust, and every psych med just made me worse because clearly it wasn't just a conventional, serotonin imbalance or something like that. And then I finally really went downhill, and I had to get myself to somebody who knew what they were doing, which was not the UC Davis Medical Center, although the head of neurology there was really great, but most other people were either unhelpful or just downright rude, or when doctors see things that they haven't seen before, just a bewildering array of symptoms, they just think you're making it up. Their minds can't comprehend this many things going wrong with a person, but when you have neuroimmune disease, that many things do wrong. Like pretty much every single thing that could go wrong does go wrong with your body. So trust your instincts. Find somebody who can help. So I'm almost on the heparin lock. I just did the saline. There is a really good online, somebody from the old Phoenix Rising threads posted, I think it's a roadmap to ME/CFS testing and treatment. It's on Google somewhere, I think somebody's Google pages, but I think it's called ME/CFS testing and treatment roadmap. I would start there, especially if you're looking for a doctor. You might have to fly to see one, unfortunately, but it's well worth it. I mean, rather than spending years or the rest of your life in bed or completely disabled and a lot of pain and suffering, really good idea to get yourself to somebody who knows what they're doing. There's also a YouTube channel called ME/CFS Alerts with Llewellyn King and Deborah Woroff. I really like that channel. They do a good job of although it's been a while since they've interviewed most of the MECFS specialists around the country, like Dr. Montoya and Kovalnik from Stanford and OMI, and Nancy Klimas and Kenny DeMerler. So really, the people who've been involved in neuroimmune disease research, they do a good job of interviewing them. I would start there as well if you're looking for a doctor. The MECFS testing and treatment roadmap. This is the heparin. And so this is what the last thing that you push into your PICC line, and then you apply the heparin lock. Heparin just, is an anticoagulant, so you don't get a bunch of blood clotting. And you wear in your PICC line. And then the last thing is this very handy green cap, which contains alcohol. So I don't probably actually really have to do this last step, but it's probably just a good idea. You don't want an infected PICC line. In fact, the nurses who changed my dressing at the UC Davis Medical Center, a lot of them have suggested a port because I'm on antibiotics for so long. I'm sure there's a reason my doctor chose a PICC line. They're easy. I guess they do get infected quite a bit. Even if you're on a bunch of antibiotics, there's always, sadly, some resistant bacteria or other microbe that can grow on your PICC line inside your body, biofilm producing, who knows, stealth pathogens, other things. But so far I haven't had a problem. It's been a couple months, but I am pretty scrupulous too. You have to be really careful with the PICC line. Don't get it wet. It's a pain in the neck to take a shower. I wrap my PICC line really tightly with saran wrap, and then I wear a sleeve as well. Okay, this is the last step, this nice little green alcohol cap. And we're done. I wrapped my PICC line up. Some of the nurses were making me these pouches to put the PICC line in, but the problem is stuffing a PICC line into the pouch tends to bend it up here, and I got a kink. You do not want a kink up here in your PICC line because I might have this PICC line for the better part of 2 years. So that is the part of the PICC line that goes into my body. You want to be very careful with the top here. If the bottom kinks, which it will, it's not a big deal because you get that changed once a week. So good luck, and I will post some more videos on other treatments I've tried, including bacteriotherapy or fecal matter transplant.